Support for Radio Friends comes from OsteoStrong. Improvements in bone density, strength, and power can be achieved by weekly 5-minute no-sweat sessions on their 4-spectrum machines. These isometric robotic machines safely emulate high-impact loading on different parts of the skeletal system, which stimulates activity in bone-building cells. Balance and agility can be improved by 2-minute sessions on vibration plates. Every session is supervised by a trained coach. Learn more on Facebook or call to set up a complimentary wellness assessment and session.
Good morning and welcome to Radio Friends on this Thursday, December the 10th. Good to have you with us today. We're going to talk about diabetes and kidney disease, and I've got an expert with us, Dr. Smirta DORAIRAJAN.
It's a pleasure to be here, Paul.
Thank you for coming. You are a specialist in kidneys,
Yes.
kidney disease. First of all, how many people are suffering with kidney disease?
So, diabetic kidney disease, this is the leading cause of chronic kidney disease as well as end-stage kidney disease worldwide. So, when you have diabetes of over 20 years duration, about 50% of the patients will land up with this complication, and nearly 30 to 40% of patients with end-stage kidney disease starting dialysis is from diabetes.
So you said if you have diabetes for over 20 years, does that mean if you've had diabetes for over 20 years and not treated it, or does it mean if you've had diabetes for 20 years and you're treating it and keeping it under control, you still can end up with problems?
Yes. So the duration of the diabetes as well as the severity of the diabetes both play a role.
Even if you're treating that diabetes?
Yes.
So what do you do?
So you have to catch it very early on. So every patient who has type 1 diabetes of over 5 years duration, and at the time of diagnosis of type 2 diabetes, which is more like an insidious, sneaky thing that comes up, they should have annual urine test as well as a blood test to test their kidney function. So even if they have like micro amounts of protein in the urine, you're not supposed to have any protein in the urine. But when you have like even 30 to 300 milligrams of protein, we call it as microalbuminuria. So this is a very early indication that the diabetes is affecting your kidneys. So when you target it at that time and start getting your diabetes under very good control, then you can prevent kidney disease in the future.
You can prevent it totally, or will you at one point, if you have diabetes, will you still have kidney disease?
We can prevent the progression of the kidney.
The progression of it.
Yes.
If you are diagnosed with kidney disease, what are your options? What can you do?
So all my patients ask me, is there a magic pill that I can just take to reverse the kidney trouble? Unfortunately, there's no easy solution. It's all the basic things. So you have to get your diabetes under very good control. That's the number one thing. Then blood pressure should also be under very good control.
So blood pressure can cause kidney problems?
Yes.
High blood pressure?
Yes. So it can cause kidney problems. And if you're a smoker, quitting smoking is a very big favor that you can do yourself.
How does smoking affect the kidneys?
So the smoking causes, there are small filtration units in the kidneys, and it causes sclerosis of these filtering units. So when you smoke for a long time, it causes a lot of kidney scarring, and it can cause protein to leak in the urine and can cause damage.
Smoking can do that?
Yes.
So I always thought of smoking just affecting the lungs, but it does affect. What about secondhand smoke, if you've been around a lot of secondhand smoke?
So secondhand smoke also has the same damage as firsthand smoke. So we have to prevent that too.
Can diet play a role in kidney disease?
Diet plays a huge role in kidney disease.
Isn't it the protein? You want to, if you have kidney disease, do you want to reduce the amount of protein that you're eating?
So we don't restrict the protein too much, because our group of patients run into malnutrition a lot. So that can low albumin levels in themselves can be a very great risk factor.
Okay, you lost me on that. What again?
So
now?
albumin is a protein in the blood
Yeah.
that we test, and very low albumin levels cause inflammation and progression of like kidney disease. They land into like trouble with issues.
Okay.
So we want to restrict it at about 1 milligrams per kilogram.
So what does that mean? You eat less protein or more protein?
It's like medium level of protein. So now there are more studies showing that plant protein is the best way to go. You don't need any animal protein. And plant protein, plant-based protein is found to be much superior to animal protein.
Really? So
Yes.
if you're eating plant-based protein like beans,
Yes. Nuts, legumes, lentils, pulses, these have been found to be highly beneficial.
much better than animal protein.
Yes. So that
Okay.
is a misnomer,
I'm
saying
looking at
that
Grace.
animal protein,
Yeah.
you need that.
Our floor director over there, Grace, she eats no animal protein.
Yes.
Only plant-based. So she's doing good for her kidneys.
She is really doing good. And the other thing is to cut out all the empty sugars. So a lot of things that are marketed as healthy for you, like vitamin water and all the sports drinks, all these have a lot of sugar in them. So nearly 30 to 40 grams of sugar in all this.
What if you buy a no-calorie sports drink?
So the other thing with that is they supply it with artificial sweeteners. So they're using a lot of artificial sweeteners to compensate for that zero.
So you recommend to stay away from that?
Yes.
Just
so
drink
the
water.
artificial sweeteners have their own problems. They switch the way your body reacts to sugars because these are like 200 to 600 times sweeter than the real sugars. And so they modify the way that your body releases insulin. And in fact, you end up with more craving and eating more calories when you are on this artificial
I didn't
sweetener.
realize that.
Yes.
Well, you have got all kinds of information. Then just drink water would be the best thing,
yes,
right?
water is the best thing.
Yeah.
And then the breakfast cereals, the breakfast bars, protein bars, all of these also are loaded with a lot of sugar in them.
Don't do those?
So go back to like reading labels. So if sugar appears in the first 2 or 3 ingredients, it's very bad for you. That means it has a lot of sugar in it. So
Okay.
even barbecue sauces, spaghetti sauces, ketchup, all this you have to read the labels
Okay.
for hidden sugars in them.
Thank you so much for your information. Will you come back again?
Yeah.
Boy, my kidneys are feeling better already. Just listening to you. Thank you, Dr. Tmota. I appreciate
Yeah, it was a pleasure being here.
It's always a pleasure having you on here. And tell your wonderful husband, Anand, that we said he's going to be on here real soon, too.
Definitely.
All right. Something you'd like to hear or see, I'd love to hear from you. Drop me an email. That's pepperp@missouri.edu. Bye-bye.